All right, good morning, everyone. It was supposed to rain today. It didn't. So it's a beautiful day here in Arizona. I'm glad some of you could make it from out of town. I want to welcome you to our second Updates in Amyloidosis CME of 2024. I'm Sandesh from Arizona State University, Southern Arizona, VA. I want to thank our steering committee, Dr. Chris Vijay, Julie Rosenthal, Michael Castro, Janice Guzman, Eileen Spangler, and April Johnson for making this happen. These are my disclosures. And thanks to the ACC Arizona, Institute for Future Health, my colleagues, all the faculty, moderators, and panelists, ASU team, and Gila River Resorts, and our volunteers. I want to thank our event sponsor, AstraZeneca, coffee break sponsor, BridgeBio, and lunch sponsor, Alnylam. We also received continuing medical education grants from AstraZeneca, Pfizer, and Alnylam. We are offering 6 hours of CME credit, and I just want to talk for 2 minutes about the significance of amyloidosis, the highlights of a past year, the treatment pipeline, and knowledge gaps. So it's really exciting that amyloidosis is now part of the heart failure guidelines, and I think this figure, this is in their guidelines, and I think it's sort of straightforward and also complicated at the same time. And on the right side, you can see all of the different professionals that are involved in the care of these patients, and you can see that there's really a lot of different professionals from different disciplines. And the knowledge in this space is increasing on so many directions, right? From clinical symptoms, ECG, biomarkers, imaging, MRI, nuclear scintigraphy. It's hard for any person to keep track of all the developments in this field. And why are we here? I think there's different ways to look at this question, and you'll hear a lot about that today. I think one way to look at it is that these authors looked at their patients with cardiac amyloidosis, 317 patients, and they looked to see how many of them would have qualified for heart failure with preserved ejection fraction clinical trials. And depending on the clinical trial of the 8 different trials, between 16 and 65% of patients would have been entered into those trials or eligible for those trials. And the point they're trying to make is that one of the reasons why we haven't had progress in heart failure with preserved EF therapies is because many amyloidosis patients may have been sort of mixed in that population, and as a result, these therapies were not effective. But the point I'm trying to make is that this is really a paradigm shift in cardiology, and we need to be thinking about this disease irrespective of whether or not we're treating amyloid or we're treating heart failure. So what have we accomplished in 2023? So we had our first event, and Matt Maurer was a great speaker to come in and kick off this. And we had multidisciplinary speakers from Tucson and the Phoenix area, as we do this year. I think we're beginning to create an amyloid-informed community across medical centers and providers. And we did achieve some new insights on the system of care to support these patients through holding a focus group. And we had diverse attendees from different disciplines beyond cardiology, including internal medicine and geriatric. And we confirmed the need for amyloid-related education in this space. We also held a debate in August, and the topic was all adults 65 years and older with heart failure should be screened with amyloidosis, screened for cardiac amyloidosis. And we had 2 geriatricians as part of those speakers. And post-event, some of the participants working on how to advance shared decision-making in this space. We also held another debate. All African American adults should be offered TTR genomic screening. And internal medicine residents have taken up the call to try to summarize evidence in this area. And we had the benefit of having skilled genetic counselors help do that discussion. What's on deck for this year? I think that we're sort of moving beyond the idea of just cardiac amyloidosis. It's really amyloidosis. It's beyond the heart. And we have new and returning faculty covering all aspects of ATTR. We'll have a case presentation today at 4 p.m. with ACC Arizona. And we have some new topics on quality improvement, shared decision making, and informatics. There's also an implementation focus. We'll be holding a panel discussion on barriers and opportunities in polyneuropathy. We have a great diverse group of institutions represented. We have clinicians from the community, VA, Mayo, Arizona, Banner, Tucson, Banner, Phoenix, City of Hope, Honor Health, Abrazo, Dignity, and industry. We have various specialties represented. We have pathology, neurology, hematology, internal medicine, cardiology, geriatrics, informatics, and genetic counseling. And we have incorporating residents and fellows into this year's program. So, there's a lot coming. There's a lot we'll be processing in the future. These are the therapies that were approved in the past, and there are many that are in process with phase 3 clinical trials and potential regulatory approvals as well. So there's many knowledge gaps and care gaps, and I hope that we can start to talk more about these. We don't really know how often ATTR occurs and in whom. We don't really know the outcomes in real-world settings. We don't really know how to identify these patients, or maybe we have some inkling. How we're going to incorporate emerging technologies to enhance this. How can we make diagnosis easier and more cost-effective? Why are patients not receiving timely care? Where is there excess variation? How can we prevent false positives and false negatives? Can we develop strategies to improve early diagnosis? Which treatment is better? How can we maximize value? And what are the barriers and opportunities in amyloidosis care? One question that I think we should think about today is, are we ready for broad ATTR screening, given the propensity of this disease in older adults with heart failure? And how will clinicians adopt AI into their workflow? There are many developments that are happening. How are we actually going to use these technologies? So I hope you enjoy the event today, and let's get into it. I want to introduce Dr. Joff Zhao from Honor Health and Dr. Chris Vijay from University of Arizona and ASU. So please take over.